COVID-19 vaccines has been one of the greatest scientific achievements in modern history. No doubt about that. From lab to jab in under a year, that's the time from when Chinese scientists shared the sequence of SARS-CoV-2 with the world to when the first licensed vaccine went into someone's arms. Actually, a 90-year-old grandmother in Britain, Margaret Keenan. Amazing achievement. Secondly, the fact that people are now being vaccinated in high income countries is astounding, and I'm thrilled. Health workers and high risk people, that's the right priority. And my own parents, I was quite tearful when I heard that my parents had got vaccinated. As high risk elderly, my sister, who's a health worker working with patients with COVID-19 in London, also vaccinated. That is the right approach. But what I find disturbing is that I am likely to be offered vaccination ahead of a health worker or a high-risk person in a low-income country or a lower middle-income country. And that's not right. That's not fair. I'm low risk. I'm only 52. I'm white. I don't have pre-existing medical conditions, and I'm able to work from home. So that's a question of justice and equity and fairness. But as you said, Greg, I also think that it's somewhat self-defeating. There's a mantra in global health that an outbreak anywhere could lead to an outbreak everywhere. And that's why it's in our interests collectively as an international community to start sharing doses to make sure that we expand the global vaccine supply. It's been depressing watching a handful of rich nations hoard the vaccine supply. We've also seen that when you have wildly uncontrolled transmission, you increase the chances of a variant of concern. We've seen variants arise, for example, in England, in Brazil, and in South Africa. And then there's another sort of, self-interested angle in this, a kind of enlightened self-interested angle, if you like, as Jeremy Farrar of the Wellcome Trust has called it, in that it's economically terrible for rich countries to hoard doses. There was one analysis by Turkish researchers that found that, look, if rich nations are largely vaccinated by the summer and poorer nations are left behind, the global economic losses could be about $9 trillion, $9 trillion, and half of that loss would be in rich nations. And that's because of our interconnectedness. Your economic health is my economic health. Your public health is my public health. We are all in this together in that sense. Our exports would be depressed. We wouldn't be able to get things like machine parts because of our global supply chains. So all in all, the arguments have, yes, an equity and justice dimension, but they also have a really important global public health dimension. We can't hermetically seal ourselves off from the rest of the world, and an economic dimension. So that's why I would like to see more action on sharing of doses. In my piece in Nature today, I talk about tithing, a concept that many of us are familiar with. Many of us try and tithe, give 10% of our income away to charity every year. And I don't think it would be too much to ask rich nations that for every 9 doses for their own citizens, they share 1 dose with COVAX, the multilateral pooled facility. That's not a hard ask. And I don't think it's a hard ask for us to be reconfiguring some of these bilateral deals where rich nations, purchased huge numbers of doses for their own nations. I don't think it's too much to ask them to open those up, start sharing doses, start sharing know-how, start sharing, the capacity. It needn't be a zero-sum game. We can make this an arrangement that works for all.
Thank you. And I'm glad you brought up this notion of a zero-sum game, which of course means if I get mine, you don't get yours. And part of what you're proposing in your paper that you and another professor at Duke have worked on is a mechanism whereby it doesn't have to be that way, right? You mentioned already the sharing of know-how and capacity. Could you talk a bit more about exactly how that can work?
Yeah, so with some of these bilateral deals right now, game theorists would say they've been set up as a zero-sum game. Rich nations entering into bilateral purchase agreements, often before even the trials were finished, to gain doses. And it's a zero-sum game because, when the rich nation uses that dose, it's a loss to the other nation. It's a sort of classic tragedy of the commons. The tragedy of commons is where overuse, of a common good harms others. But it needn't be that way. Those bilateral deals could be established in ways that economists call ways that have positive spillovers for others. It doesn't have to be a zero-sum game. And we've seen, for example, the Serum Institute of India manufacturing the AstraZeneca University of Oxford vaccine. So it is possible for the know-how to be shared, for the processes and the process technology and I am not an expert on vaccine manufacturing processes, but someone explained to me that the manuals for processing these vaccines are literally thousands of pages. We could be sharing those. I would like to see greater sharing of the intellectual property. I would like to see patents shared. There is a WHO-led pool for sharing patents. And then the other element of this is, of course, there are still a huge number of candidate vaccines, both in preclinical development and in clinical trials. And some of those trials are going to fail, but we already have started the manufacturing of some of these candidates. It's called manufacturing at risk, where you don't want to wait. You don't want to wait to find out whether a trial is successful and then spend years getting the manufacturing in place. You want to start the manufacturing now whilst waiting for your trial result. And one of the remarkable things about working in global health over the last year, there have been many, but one really remarkable thing is that concepts that many of us were talking about in sort of the ivory tower, if you like, have really become mainstream. You saw Bill Gates chatting about manufacturing at risk with Trevor Noah on The Daily Show. And that's when I thought, oh, wow, some of these concepts are really just completely widely talked about now. The conversation is amazing. So let's say that you have entered into a bilateral deal and are manufacturing a candidate at risk, and the trial is a failure. The candidate actually isn't efficacious. Why not now transition this manufacturing process, this plant, the resources that you've invested could be used to make a successful vaccine and to distribute some of those doses in low and middle income countries. So what I'm trying to encourage with this piece is we need to move away from a sort of rich countries, me first, me only, scarcity mindset. And yes, I get that doses have been in limited supply. We need to move away from the hoarding mindset towards a sharing mindset. And ultimately, we also need to sort of reconfigure what we think is fair. And Dr. Tedros, Director General of the WHO, he called for something that he, in my marrow, deep in my marrow, in my heart of hearts, believe that was the right thing to call for. And he was ridiculed for it. And that was, he called for all health workers and all high-risk people everywhere in the world to get priority. I literally got into sort of Twitter debates and Twitter wars, which are always a terrible idea, with people who were, ridiculing that suggestion, saying, rich nations would never go for it. Well, he was right to call for it. And actually, Jeremy Farrar was interviewed yesterday, who leads the Wellcome Trust in the BMJ, and he said the same thing. Again, we understand the reality of domestic politics, and we understand absolutely that nations like the US and the UK are vaccinating their citizens now, high risk first, health workers first. I get that. I am able to sleep at night now, knowing that my parents and my sister are protected against severe illness and death. I cannot tell you how amazing that is. I want that same protection for others, and it can be done. Norway has set an example of saying, and the devil will be in the details, but Norway is saying, as we roll out vaccines to our Norwegian citizens, we will also share doses with COVAX. That shows it can be done if there's political will. I get that it's not going to be one and one. I'm a realist. Norway is unlikely to be donating one dose to COVAX for every one dose that it uses to vaccinate its citizens. But how about at least a tithing? I mean, a tithing isn't even fair, but it starts to get us along the way. And I did see Emmanuel Macron recently saying, encouraging European countries to give, say, 3 to 4% of their doses away as they roll out their vaccinations. So it's good that these conversations are happening. It's good to see that the UK has said that once everybody's vaccinated, it'll donate surplus doses, but that doesn't help us now. And meanwhile, health workers in poor countries are dying of COVID-19 when we should be protecting them.
Absolutely. Thank you. We've got another 15 minutes, so we're going to open it up to questions. You can pose questions via the Q&A window at any time. If you'd like to ask your question in person, raise your hand in Zoom and we will unmute you when your turn comes around. And if you're calling in by phone, you can raise your hand by pressing *9. We do have a raised hand in the chat, so we'll go ahead and unmute you, and please go ahead and ask your question.
Hi, can you hear me?
Yes.
Okay, great. This is Judith with CBS 17 News. I have two questions. So one, people are getting vaccinated and people are already thinking, where can I go on vacation? But, should people reconsider these summer vacations when we're seeing a lot of these countries that haven't been vaccinated? Like, is it safer to just stay here in the US? And my second question is, the Biden administration just committed to buying 100 million doses of both these vaccines. Are we ourselves guilty of some of this hoarding of vaccine?
So my point is really that what I would like to see, and I understand that hasn't happened, but what I would like to see is that we vaccinate the highest risk people first, health workers and high risk in each country. And, I have somewhat of a dog in the race, as they say in Britain. That probably doesn't translate very well. A horse in the race. Not much dog racing in the US. I care about this in part because I was very kindly invited to part of a working group originally to help advise in the design of COVAX, the facility that was really all about trying to make sure that every nation initially got enough doses to vaccinate, say, 15 to 20% of its population. That would be enough to cover all health workers and high risk people. What has happened is that, yes, the US and the UK and Canada and many rich nations, you're right, Judith, did enter into these bilateral purchase agreements outside of COVAX. I wish they had gone through the multilateral mechanisms. They went outside it, and they bought enough doses to vaccinate their whole populations multiple times over. So Canada has bought enough doses to vaccinate its whole population 5 times over. And the UK and the US are not far behind with enough to vaccinate their whole populations 4 times over. Now, obviously, and I know that we don't have those hundreds and millions of doses sitting right now ready to go. Those are still being rolled out. But my piece really is saying the right thing to do for all the reasons I mentioned, reducing transmission worldwide, the economic benefits, the questions of fairness and justice. We need to, I believe, move away from a nationalistic thinking. We need to stop thinking only of our own nation. We need to start thinking of ourselves as an interconnected global community. we're earthlings. It sounds a bit corny, but, we're all earthlings and we're all in this together in many ways, and I think as nations, in some ways, it's as if we're kind of ships on an ocean and we're going to rise and fall together. And it's been, dispiriting getting into conversations. Again, I probably shouldn't be on social media because it's so many depressing, conversations with people who say, well, other countries are doing great with non-pharmaceutical measures. Thailand, Vietnam, Mongolia, they've reduced their transmission enormously. I mean, in many of these countries, as you've seen, Australia, New Zealand, life has returned to near normal. And honestly, I've had people say to me that, there's no point giving countries like that vaccines. They're doing really well with these other measures. But that, to me, is unbelievably depressing. We could have been using those other measures here in the US. We all could be using those other measures to drive transmission down. It's a weird sense. Why should we penalize countries that have done well using these other public measures by denying them vaccines? And I make the point in my piece that when, how are citizens in those nations going to respond in a future pandemic, if they think that doing well will deprive them of vaccine access? So yes, I do really want to see us rethink our vaccine strategy. And as Jeremy Farrar said, with Britain, once Britain has vaccinated all its health workers and high risk, similar here in the US, once we vaccinated all our, essential workers, teachers, so that we can get schools open, health workers, let's start sharing doses. Thanks, a very good question.
So, Dr. Yamey, we've mentioned what the US government is doing. The Trump administration didn't make any moves to join COVAX, but President Biden has pledged $4 billion towards equitable vaccine distribution. How much difference can that make? And do you expect that the US will actually take any active role in COVAX moving forward?
So it's a fantastic question. And obviously all eyes were on the US during the Trump administration, not joining COVAX. Many rich nations have joined COVAX. And without getting too into the weeds, apart from the sort of the COVAX facility where rich nations can buy doses, self-funded nations, and lower income countries have their doses purchased for them, there is also a fund called the COVAX AMC, Advanced Market Commitment. And that is being used to buy doses for low income countries and lower middle income countries. And we absolutely need money. We need funding. It's good news. How can you knock $4 billion from the US? That's $2 billion now, and then there's a sort of a carrot, and another $2 billion if other countries come on board as well. We've seen other pledges from European countries and the EU. All good. Don't get me wrong. I'm an optimist in general as a person, and I like to call out great news when I see it. This is fantastic. But it doesn't get us around the problem that I address in my piece in Nature, which is this problem of hoarding of doses. You can have money sitting there, but if countries, have hoarded doses, that money is not necessarily going to be that helpful now. And you saw the stats, right? I mean, it's probably changed since when I wrote this last week. We're probably at about 200 million shots now, but over 3/4 of those have been given in just 10 nations, accounting for 60% of global GDP. And in about 130 nations, representing 2.5 billion, not a single shot has gone into an arm, zero. So money is great. We need money. It's a necessary but insufficient step. But we also need doses, and we need, sharing of doses, and we need ways to massively, aggressively around the world manufacture doses. I mean, I'm someone who believes in a sort of an all of the above approach. I got into some very interesting discussions. I obviously clearly spend too much time on Twitter, but with some really fascinating academics last night who've done a lot of work about IP, intellectual property and patents, and opening up, the process, sharing of patents. Great. all of that, yes, but we also need to massively globalize manufacturing, and we're going to need that now, and then we're going to need it for future pandemics. We're in a pandemic era, Lord help us, and we are going to need globalized manufacturing for the future. I think countries should. I mean, I'm a realist, I'm a pragmatist, and I'm an all of the above person. I personally think that countries should be allowed to make their own generic versions or import versions, so-called parallel imports or compulsory licensing. But we also, in my humble opinion, and yes, I was involved in advising on the design of COVAX, so I have my own biases. I want to see greater support for COVAX. As far as I know, it is the only multilateral mechanism for ensuring global vaccine equity. And, if all goes well, and increasingly, as every day goes by, I'm actually more and more optimistic and more heartened. COVAX will be delivering 2 billion doses by the end of the year. And that is astounding if you think about it. And particularly if you think about what has happened in previous pandemics. We never had anything like a COVAX, let's say in 2009 during swine flu, H1N1, where again hoarding took place. Rich nations rushed to enter into these bilateral purchase agreements with vaccine manufacturers, and rich nations got more vaccines and they got it earlier. And once again, less wealthy nations were left behind. This time around, we put a mechanism in place. And what I would have loved to have seen is that rich countries would have adopted this mechanism for buying their doses. If more rich nations had bought doses through COVAX, there would have been very many benefits, not just for funding manufacturing, funding development, funding manufacturing at risk, but also in the sort of advantages you get when you have a pool of buyers. You can drive down drug prices. So it would have been advantageous for more nations to do that. That's not where we are today, but I would still argue that COVAX is on course to do really spectacular things by the end of the year, potentially vaccinating all health workers and high-risk people by the end of the year. But again, I'm probably going to be offered vaccination here in North Carolina quite soon, potentially even in the next few weeks or months. It's that imbalance and injustice that I talk about in this piece.
Thanks. We've had another question here, wondering if you could give an example of what could happen in terms of public health, the difference that it will make with, say, healthcare workers in a poorer country not receiving the vaccine until the end of the year versus right now. Yeah, What's the kind of scenario that could happen? I
mean, it's just been, honestly, it's very hard not to be. I think we're all quite emotional right now from the pandemic, from the grief here in the United States of 500,000 dead, of the gross malpractice and incompetence of the Trump administration. And it's frankly, not just incompetence, but malice in how it responded to the pandemic here. So we're all very emotional. And many of us are working long hours and so on, but it's very hard not to be very tearful when you read story after story after story after story after story of health workers dying right now in low-income countries and low-middle-income countries from COVID-19, which is a preventable illness. The vaccines are exquisite in their efficacy and safety at preventing illness and death. That is a protection that we should be extending to health workers who are putting their lives on the line day in, day out. And we have this extraordinarily powerful tool now. Why are we denying it to those who are putting their lives on the line? And also when health workers die or are sick and a health system becomes weakened and potentially even collapses through the death of its health workers, it's going to be much harder for a nation to overcome this outbreak, the next outbreak, future health challenges. It's been frustrating. It was equally as frustrating in the United States when health workers were not given high quality personal protective equipment, and so many got infected and so many died in the UK as well, disproportionately people of color. And I mean, this is probably not the right forum to relitigate the Trump administration's failures, but that one hit really hard, their failure to protect health workers, our national and international treasure.
Absolutely, thank you. I know we're getting ready to wrap up here. And you've kind of implied this a little bit, but I wanted to get explicit about it. Are there any signs that any rich countries, have adopted the kind of things that you're recommending, joining COVAX, sharing know-how, sharing capacity? And if not, is this year at least an opportunity for COVAX to prove it can work, so that the next time there is some kind of global pandemic like this, it can be a system that more countries will adopt?
So look, as I said before, I'm an optimist. I think, COVAX is, you've already seen getting more doses, fantastic news. On course to acquire and potentially distribute 2 billion doses this year, astounding. Almost all nations joined COVAX. That wasn't the issue. Many rich nations joined COVAX. I wish they hadn't then bought up the global supply through bilateral mechanisms, clearing the shelf. But things are changing in very positive ways. Not fast enough for my liking, but you saw, Norway's commitment. You've heard from some leaders saying they're going to think about donating 3 to 4% of their doses. We're seeing more and more funding to buy doses for the funded COVAX countries through the advanced market commitment. These are all very promising signs. And again, I come at this with my own biases, but the reports of COVAX's demise are incredibly premature and unwarranted. There wasn't a COVAX in previous pandemics. It's not the easiest thing in the world to, in the midst of a global pandemic, the worst in 100 years, put a mechanism in place, a multilateral mechanism in place very quickly that everyone's going to laugh. That's just the reality of it. And I can tell you that from having been in some of those advisory meetings that went on for hours and hours. These are not easy things to do. Very difficult to stop. You can't stop bilateral deals. The idea was, could you have a mechanism in place that would make things more fair? So things are getting better. And, in my piece, I cite a Bloomberg study that had shown that if the current rate of vaccination in low and middle income countries continues, those countries are probably not going to reach vaccine herd immunity for another 7 years. I'm optimistic that that's not going to be the case. And that is partly, in fact, in large part, I think, due to COVAX. There will be other ways in which vaccines are acquired in low and middle income countries. There will be bilateral action for sure from say China giving doses away to individual countries, from Russia giving individual doses to individual countries. We're going to see a whole range of approaches going forwards.
Absolutely, thank you. And I know we need to call it there, so thank you everyone for joining us. Thanks to Dr. Gavin Yamey for sharing your perspective. The commentary he's been referencing published today in the journal Nature. You can email us at dukenews@duke.edu if you would like a copy of that. Next week, we'll be discussing the mental and emotional toll of the pandemic as we near a full year since it struck. If you'd like to be notified of that and other upcoming briefings, please, again, email dukenews@duke.edu. There's been lots for policymakers to chew over here. And on a personal level, I think if we've learned anything, it is that Twitter wars are never a good idea. So please have a great day, stay well, and thank you for joining us.